Welcome to Mediquap's masterclass. Our today's masterclass topic is adult periodontitis, and in adult periodontitis, we'll be learning chronic periodontitis. Now, let's see the definition first. So, definition says that chronic periodontitis it occurs as a result of extension of inflammation from the gingiva into the deeper periodontal tissue. Now, here in this image, you can see. So, this is the level of gingiva in this image. Usually, it has to be at this place, that means at CEJ. So this is cemento enamel junction. Now you can see that this recession it is evident in every single tooth. So that means that it is a case of chronic periodontitis. Now chronic periodontitis either it can be localized, that means it is involving less than 8 teeth, or you can say less than 30% of all the teeth, or it could be generalized. Now, when to say that this is generalized? So, when it is involving more than 8 teeth, or you can say more than 30% of the teeth, then it is known as generalized chronic periodontitis. Now, this chronic periodontitis, it occurs over a period of time. That means it is occurring gradually. Okay, so this is of gradual onset until and unless it is of aggressive variety. So aggressive periodontitis, it can occur at younger age and it can occur like very fast. Okay. Now coming on to clinical features. So clinical feature, age of onset, it is 30 to 35 years. This condition, it is usually generalized. Gingiva, it is swollen and color ranges from pale red to magenta. Usually the color of gingiva, it is coral pink. Now loss of stippling. Now stippling. So our gingiva, it has an orange peel appearance. But when there is gingivitis or periodontitis, this stippling is lost. So loss of stippling will be there. Then blunt or rolled out gingival margins will be there, and flattened or cratered papilla will be there. The next set of clinical features says that spontaneous bleeding may be present. Now bleeding, usually when you put probe into the gingival sulcus. So suppose that this is the tooth, this is the gingiva and this is the gingival sulcus. So when you put your probe, usually it does not bleed if the patient is having like good oral hygiene. But if the patient, if he or she is having gingivitis or periodontitis, then what you can see, bleeding will be present. Then both supra-bony and infra-bony pockets can be seen. Then tooth mobility, it is seen in advanced cases. Then coming on to microbiological feature. So this slide, it is not so important, but this is important from Viva point of view. So examiner can ask that what are the microorganisms which are responsible for periodontitis. So you should know few names. So let's see these names. Prophyromonas gingivalis, Prevotella intermedia, Capnocytophagia, then Actinomycetocomitans, Echinella corrodens, and Campylobacter rectus. So you need to learn few names just for the Viva you can say, but if you write in your exams also, you can score good marks. Then coming on to next thing, that is radiographic feature. Now radiographic feature, it is important from oral medicine and radiology point of view also, and from periodontology point of view also. So basically we will be seeing bone loss in this. So vertical bone loss will be there and horizontal bone loss. Now we can think that the name signifies vertical. So here in this first image, what you can see, that angular bone defect is there. So that means that when the attachment loss and bone loss on tooth surface, that is single tooth surface, it is greater than on the adjacent surface, then it is known as vertical bone loss. Now here in this first image, what you can see, that here is the bone defect, but here bone is normal. So this is vertical bone defect. Now similarly in second image, so this is bite wing radiograph. Here what you can see, that already it is marked with yellow. So usually the level of gingiva, it has to be at this place, okay, at this. But here you can see that this is the recession. So this kind of bone loss, this is known as horizontal bone loss. So it says that when attachment loss and bone loss occur at a uniform rate on majority of the tooth surface, then it is known as horizontal bone loss. Now coming on to types. So I already told that there could be a localized periodontitis or generalized periodontitis. So when it is involving less than 30% of the teeth, or you can say less than 8 teeth, then it is localized, and generalized when it is involving more than 30% of the sides, or you can say more than 8 teeth. Okay. So this is dependent on the disease distribution. Now next is based on the disease severity. So based on the disease severity, it could be mild periodontitis, moderate and severe. So this is first, this is second, and this is third. Now, mild periodontitis, as the name indicate, mild. So not more than 1, or you can say 1 to 2 attachment loss will be there with little or no mobility and with minimal bone loss. In cases of moderate periodontitis, what will be there? 3 to 4 attachment loss will be there, and moderate tooth mobility will be there with loss of bone up to 40%. Then in severe periodontitis, the attachment loss, it is more than 7 millimeters, and excessive tooth mobility will be there with bone loss of more than 40%. So here in this first image, you can see that this is a case of mild periodontitis and moderate and severe. The next, coming on to risk factor. So this risk factor, this itself is a short note. So apart from this generalized periodontitis or chronic periodontitis, these risk factors can also be asked as a short note. So risk factors include local factor, which include calculus, overhanging margins of restoration, then subgingival carious lesion, crowded or malaligned teeth, and root surface irregularities. Now, what are the environmental factors? So smoking can cause chronic periodontitis. Then systemic factors like diabetes. So in this diabetes, recession will be there. So periodontitis can be seen in cases of diabetes and other systemic diseases as well. So again, it's a conclusion slide of risk factors only. So first of all, there will be plaque accumulation due to poor oral hygiene or tooth malpositioning or tooth anatomy or restoration. Then because of this, what is happening? Presence and quantity of certain bacteria will increase. Host defense mechanism will be there. Subgingival environment will modify. Then restoration, if there is any kind of restoration, like you can say that class 5 preparations will be there. So in those cases, then calculus and smoking, what this will lead to? Connective tissue destruction. So once this connective tissue destruction is there, genetic influence, inflammation, periodontopathic bacteria, smoking, calculus, they will again act as a modifying factors, and this will lead to loss of attachment, and this is how periodontitis is caused. Okay. Thank you.